I'm Dr. Ramadevi. I'm a neurologist, medicine specialist. My training was mostly in the United States, but I returned to India and I'm currently the managing director of Amra Hospital in Tirupati. Well, my journey to becoming a doctor took a lot of thought and reflection to decide to enter the medical field. My entry into management wasn't actually planned. I did have leadership roles while working as an associate professor of neurology at Northwestern University, including Director of Medical Education in Neurology and Director of the Sleep Fellowship Program and Director of the Insomnia Program. However, other than that, I never thought of management as a career. But when my husband and I returned to India to start a hospital, I realized that my involvement in the management was critical. 1 year before returning to India, I took a course on organization development that really helped increase my perspective on management principles, and this really helped me. I think being a doctor, number one, and also learning about evaluation assessment, both as an education specialist and during my organization development workshop, this put me in a position to really understand how important it is to have processes and quality indicators. Key initiatives I took, especially from the nursing perspective, was to develop an onboarding and training program with help of other senior nurses and nurse education specialists, and also to develop assessment methods to really understand if they understood what they were doing. Later, developing processes and how morning rounds need to be conducted and how different processes need to be conducted, and following to make sure that there's a correct processes in place was very important. Other things that I found is a lack of documentation, which makes it very hard for healthcare professionals to communicate with each other and even to remember what was done during previous visits. So we instituted an electronic medical record system, doctors to communicate with one another and for there to be continuity of care. I really enjoyed my role as chairperson of Andhra Pradesh Indian Women's Network. It's given me the opportunity to meet many women around the state, both well-established women just starting their careers, and also I've tried to include women looking to re-enter the workforce, women who've taken a break, not actually entered because from the time of marriage, they've not had a chance to enter the workforce. I feel there's a lot of motivated women, and with proper mentoring and support, we can really develop further women leadership. Women leadership is really important because their perspectives are different. The way they see things are different. Their involvement in both home and the workplace gives them a very different perspective of what's required for the well-being of not only different families, but also the community as a whole. So it's really given me a chance to work with other women and help them in multiple ways to try to reach their full potential. I think it's really important students, especially whether they're learning to participate in the IT sector, including electronic medical records and other IT support for hospitals or MBA, to really understand the hospital system. Because going straight to the numbers or going straight to the software without understanding what the doctor's needs are and what they're looking for, creates a lot of problems. For instance, if you're trying to help with electronic medical records, really understanding how the patient goes through the system from registration process to, the initial visit, follow-up visits and what's needed. Also understand where the doctors are coming from to start with. See if they're used to looking at a paper record, what's making them uncomfortable with using an electronic medical record. If you understand all of this before starting to put programs and systems and other things together, it's really going to help you in your journey. And same with MBA, understanding these things, because medicine is, after all, we're dealing with human suffering, we're dealing with patients, and they're coming up, patients who come to us are suffering and also may not have the resources and the planning ahead. So understanding all of this before starting with the management will really help. focusing both on health insurance as well as cost effectiveness and healthcare. These are two areas that I think still need a lot of work, and anybody with, I think, good ideas can definitely enter this field and try to help in these areas. And the second is telemedicine. While telemedicine, it's not just about the technology, it's about the connection between the end user and the doctor. Even though people from all over the state have problems with their health, the experts may not be able to be present everywhere. And we have to be careful with which doctor is giving the advice and how they're giving it. I think every smaller center should have some type of connection to higher centers. Like for stroke, if a stroke were to occur, what can they do in their center before sending to higher centers? And even primary healthcare centers, if they can have access to doctors in higher centers, I think it would be very helpful to all parts, because travel is very difficult, especially in certain situations. Thank you.